There are many reasons why community health workers are important. One, they are our frontline healthcare workforce. They are out there in the community. They have an effective way of delivering public health messages, prevention messages to vulnerable population. The second piece is they are in the community. So they are a trusted member of the community. They have a better understanding of the culture in that community, and they can tailor their response to the needs in that community. Another reason why community health workers are important is we know that they are beneficial when it comes to the healthcare costs for the whole healthcare system. There is enough evidence right now that shows that community health workers interventions could lead to less emergency department visits, less hospitalization, and this is a good thing for our communities.
Community health workers are used in a whole variety of ways, but one of the most important ways today is everybody's worried about how we control healthcare costs. Is there a way to bend the cost curve? Now, what we've seen here at Sinai Health System, and the Sinai Urban Health Institute, is by having community health workers who understand the disease process, understand their neighbors, understand their community, actually work hand in hand with those neighbors, lead them through the healthcare system, and help them at a very basic level change the way they live, the way they behave, the way they keep their houses clean in some cases with asthma, to really make a huge difference in the spending around healthcare. Very impressive and very powerful impact. If you want to translate that to dollars, this is very compelling and one of the best rates of return I'll ever see in my lifetime. For every dollar invested in a community health worker, we've avoided spending between $13 and $15, depending on the acuity of the case, in acute care services, ED visits, admissions to the hospital. And that doesn't count the time lost work by mom or siblings who are not going to school because they're all supporting the person who's in the emergency department.
Our promotores are community health workers. They're promoters of health. We call them promotoras de salud. Right now, most of the classes they do are in Spanish. So in Spanish, promotoras de salud are promoters of health.
The way the Promotoros program helps Northwest Community Hospital is, number one, by diverting unnecessary emergency room visits, but because this program really does help people find medical homes and provides them with health information that's going to keep them out of the emergency room. The Promotoros lay the groundwork or basic knowledge blocks for them on particular health topics. But the other part it does is opens up the resources to them. Our community clinics around here are very overcrowded. Up to a 6-month wait for a new adult patient. So getting prevention care and getting in to see a doctor when you're on public aid or if you are uninsured is very difficult. Our promotoros deliver these health messages and then send them to our community nurse Rose or get them into one of our community clinics if there's an issue through Rose because she has all the relationships. And keeps them out of just going to our emergency department to get their regular basic medical care.
It's become very clear that health care for an individual as well as for the population is improved by the team-based approach as suggested in the chronic care model, which means that it's not just about a physician or a provider alone being the sole giver of care, but the team that incorporates everything from social workers to nurses to mental health workers and others that can help meet all the needs of the individual patient. There are two important components of that team that need to be mentioned. One is the patient themselves as an important component of that team, and the second is a community health worker, that link between the community and the hospital and the healthcare system. That link that can bring much of the understanding and much of the education from the team to the home, to the patient's home, who can follow up the patient following discharge and make sure they have their medications, who make sure that they're taking their medications and that they're compliant with their regimens, medical regimens, who can also assist in education and in information sharing with the patient.
The decision for Alivio to really engage and hire community health workers was a pretty simple decision. First of all, as a federally qualified health center, a community health center, our mission is to serve people who really are the vulnerable, who are the working poor, who don't have insurance, the immigrant, the undocumented. And as a grassroots person, I value the fire in the belly of ordinary people from the neighborhood that can really relate to their peers who are in the same situation they are, but also bring the value in also sharing information that they need to have a better quality of life. Goal is to integrate community health workers, compañeros en salud, with primary care. You know, people talk about integrating behavioral health care with primary care. Well, that's no different in this whole Accountable Care Act that we are looking at to implement. The process, the words of the day are coordination and collaboration, efficiencies, and quality. And so for us to really have that and make that happen, the physician also has to be very focused in what he does in his clinical care of the patient, and he cannot all do that all alone. He needs partners, and some of those partners can be community health workers.
The care delivery model no longer just has to be the physician. You know, it's the physician, it's the mid-level practitioner, it's the nurse, it's the medical assistant. Now we have a role called care coordinator. It can be the interpreter. It can be a team of people, including health educators or community health workers. And we're trying to think through what skills those are. But we know that the model has changed because we want the entire team to be able to proactively care for a population of patients. So we see nurses, you know, being engaged by answering questions from patients in a new way. And we see community health workers and care coordinators querying the database to find out who needs to come in for care, who hasn't been in for care, and then to contact that patient. But the key is we want that group to be relational. You know, we want them to be able to interact with the 5,000 people and to have a relationship with them that's a relationship of trust. So it's no longer just the physician and the patient, it's a team of people, but we're still learning.
The Vista Clinic is normally a 4 to 6 month wait to get in as a new adult patient. So our community health workers can provide education that these doctors are so busy. They just don't have time to sit down and counsel a patient and give nutrition information. So they send them over to our promotoros classes.
Mi nombre es Rosa Vasquez, soy promotora de salud y en este caso vamos a hablar acerca de la importancia de saber qué es la diabetes y también la nutrición. For example, one person has a diabetic. Teach to them, explain what is that, what they have to eat, and then we send Rosa, the nurse. Mm-hmm. She's the person to help with those things because she has the right person to.
The health workers open the door. You know, you provide the basic education and then open the door to other resources in the community, trusted resources.
So instead of using my office visit, which especially in clinics is so limited, they have more information already. They already have more education as far as the information that the promoters have given them.
Everybody talks about in the healthcare field, the healthcare disparities. And so our patients really need support from another person that gives them, after a visit from a doctor, okay, how do I manage this thing called diabetes? You want to integrate the community health worker, or what we call compañeros en salud, with primary care, with the care of the patient.
So the community health workers, you know, here at Lawndale represent sort of two groups of individuals, one being the community health worker or outreach workers, as we call them, who work on the outside in the community at various locations, doing any number of types of screenings where they are looking at individuals all over the community, screening them for diabetes or high blood pressure, educating them about either one of those illnesses, providing them with resources, verbal information, an education that, would, in those instances that's necessary, bring those individuals into care. So some of the places that people like Frances Nance, who is one of our community health workers here at Lawndale, goes to is on a regular monthly consistent basis. She's at churches, local churches, all in the North and South Lawndale community, and the East and West Garfield community, and even near Archer Heights. In addition to her doing just diabetes checks or blood pressure checks, she does presentations where she's talking about diabetes and high blood pressure and those kinds of things that are necessary to educate people in the community who would otherwise not necessarily be in the clinics. These individuals can be homeless, they can be individuals that may not have insurance, are not showing up in the clinics where they need to be showing up in order for them to have, access to medical care.
Well, let's talk about sodium. Everybody's saying cut the salt, and people say, I cut the salt. But you buy soup, and it has sodium of like 800, 900 mgs, okay? And so here you are, thinking you're eating healthy, and you're not. And so our compañeros en salud, our community health workers, really help our patients distinguish what the good foods and what the bad foods are. We have a project called the glaucoma screening. And what it is a lot of our, and this is with the diabetic patient, another thing they have to worry about is glaucoma. And, and what happens is they get a screening here, but it's the community health worker who has been trained to do the screening. And then we have a partnership with the Illinois Eye Institute, where then if there's, after the testing of the patient, if there's a negative result, then they're referred to the optometrist. Our community health workers have also helped women in relationship to their pap smears, in relationship to the breast screening tests. So, that they should get these tests.
¿Ustedes saben cuáles son algunos de los vegetales con almidón?
Sí, la papa que no está aquí.
We also encourage to take our class because it's not just for diabetic persons. It's just to awareness, to prevention. What is the diabetes and how we can prevent the illness, and not just diabetes, also the blood pressure, the high blood pressure or the cholesterol, by changing our way to it, so to have a better nutrition.
Community health workers are the army of people who, in one way or another, and sometimes make a difference in patients' lives because they help prevent it to go to another stage.
But if they really need more help, we just recommend to go to the nurse if they need specific things.
Have any of your clients jumped in the exercising with you?
Yeah, also we were doing the Zumba. We also create a walking club last summer, and many of our participants that I knew, I called them and say, we're doing this, you want to join us? And yeah, we form a group like 15 women during this summer.
Improved patient satisfaction with the presence of community health workers is a no-brainer. I think ordinary people like to talk to their peers, and a community health center is a peer to our patients. It could be their neighbor, it could be their friend, but they know they're from the neighborhood. They're just grounded people.
Some Spanish people, they don't know English. In English, they have a lot of information, different topics, but the community Spanish, because the language is better for them, they don't have information, because it happened to me. Actually, I'm scared to go to the doctor because I don't know how make questions. I don't know if they understand me. I think the Spanish people trust the Spanish people because they are speaking the same language, and we can explain everything, what happened, what it's about, and they know. And no, if we don't explain to them what is this, what it's about, they're not trust you.
Those patients who feel intimidated by medical providers or maybe a nurse or something like that, they feel intimidated. So one of the things that we know to be really significant about the relationship that exists between the community health worker or the chronic care educator is that the relationship is easy, if you will. They don't have to worry about, am I saying the right words? Am I articulating myself in a way that the provider fully understands? Or, you know, if I don't say blood pressure right, or if I say sugar, which we know is very common among African Americans, not diabetes, but sugar. Would a practitioner know what I'm talking about? And so these are the kinds of things that make it so easy for the chronic care educators or the community health workers to engage those patients. How that translates in the clinical atmosphere is that we become the advocates.
Sinai believes that pre-primary care is a replicable model. It's something that other organizations can use to improve the health status of their community. We've written about it in a book published by Oxford University Press titled Urban Health, and everybody should go out and buy a copy. But it really tells the Sinai story, and it tells exactly the ability to impact on the community's health status. So we've demonstrated on our asthma project, for example, in 6 other Illinois communities, urban and rural, that the model works. So we know it's replicable. We know other organizations can use it. We're teaching other organizations today how to go out and do this. We think it is the way to bend the cost curve.
You can't just volunteer to be a promotoros. All of our promotoros are hand selected. They're referred to us by partner agencies. We look for really strong, independent women who want to give back to the community, who we know can be influential in the community, who have a connection with their community. From that point, we provide leadership training and then training on the particular health topics. Now, the training that Rose described has all been developed by experts in the fields. So, for example, when we did our nutrition, we worked very closely with the American Diabetes Association. When we worked on our breastfeeding curriculum, we worked with Health Connect One. When we did domestic violence, we worked with a local domestic violence shelter here to develop that. We know that we need that information from the experts. And then our community nurse provides constant ongoing training as that continues, because things are continuously being updated. We bring things back from the class that we've heard. They want to know more about healthy eating. They want to know more about the exercise, a little less about the technical. And Rose works with our promotors to revamp that curriculum.
So community health workers are out in the community and delivering important information to residents. So it's really important that we are providing them with the right tools and the methodology to deliver those messages. It's really more of a balance. So we want to make sure that there is the balance of providing the technical training on the message that's delivered, the accuracy of the information, and at the same time we want to maintain that that cultural competency that they've developed being part of that community, so that it's that balance between the actual training on the technical aspect that's important, as well as maintaining their role in the community. And keep in mind that the local network provide training. It's also the responsibility of organizations that hire community health worker to making sure that the message that's being delivered is accurate and it's delivered appropriately.
At Lawndale, the community health worker, Francis, is just a community health worker, not a person that's had any real academic training, like a 4-year degree or anything like that. I think that's pretty much the standard when you talk about community health workers. They're lay people. They represent us in the community. They look like us. That's what makes the relationships so easy to be established. There are, I think, in my experience, a small percentage of those individuals who, however, have had some post-secondary education. Bachelor's degree tends to be, out there, but some, probably more, have had associate's degree. These are people that are in our communities that are representative of the patients that we serve, in our FQHCs, and they need to look like us. They need to look like us. They need to be the people that represent us, that we can be comfortable with, and those are the individuals that I think with the proper training and certification would be the ideal persons that I think will stay, in the work.
Within the healthcare system, the role of community health workers is very, very important. We all understand that. But it's really important to think about how do we create a sustainability framework for that role. For many, the way we can create that sustainability is through reimbursement from Medicaid, Medicare, or private insurers, and the certification might be an important element in that process. And this is why we are really letting the local network here in Chicago take the lead on the certification, and will be playing more of a supportive role.
What we also know is the federal government now is starting to look more towards population health of entire populations, as a meaningful marker and metric of ways to move ahead to improve the health of the entire nation. The examples are, the Let's Move initiative by our First Lady, the Million Hearts initiative out of Secretary Sebelius's shop. The transition between population health and individual health is sometimes difficult, and is sometimes difficult for patients as well as for providers. And there is the opportunity to utilize individuals like community health workers to make that transition easier, to take the lessons that we learn at population health and translate them to the individual through their work in the homes and in the communities from which they came. The Affordable Care Act has many potential areas where the community health workers can work in the future, and in fact was just back in DC a few weeks ago when a proclamation from President Obama for the community health workers was presented, and Secretary Sebelius was there presenting to the community health workers and praising the good work that they've done, along with Dr. Coe, the Assistant Secretary. So it's clear within the federal system that community health workers and representatives are well recognized and well thought of.
Well, I would highly recommend that other clinics, community health centers, integrate community health workers in their practice. It also addresses workforce development. You hire people from the community. And also is a support to the primary care model of federally qualified health centers. I heartily endorse the presence of community health workers.
We really like what we're doing because we see the reaction for the clients after the class. That they go and shake your hands and say thank you, because I didn't know a lot of this information, because I know it's gonna help me a lot.
I think this is for my own experiences, I can help the other people. You always say, I do this, maybe you can do this. Like, for example, before I didn't do exercise, and now I do everyday exercise. I take my daughters and dance with them for 30 minutes, and I started to cut like junk foods. I don't buy junk foods in my home. Before I buy, but now I don't buy. I don't have a junk food, and then I change my home a lot. This is I told to them, if I can change it, for sure you can change it too. Yeah, this is what I'm telling to them.